Welcome back, and it's good to know you are still with us on the program. Good morning, Abuja, showing only on the Unity Station NTA Channel 5. And on to our very first conversation on the program this morning. Yes, we are going to talk about what touches every one of us. It has to do with our health. Today, we are going to talk about seasonal malaria chemo-prevention campaign that has been going on and it's still going on. And we have in the studio the Communication Officer, National Malaria Elimination Program here in Abuja. Help us welcome Akinyemi Eunice to Michelle to the program. I got the correct name,
Yes,
right?
you got it well.
Oluwatumishi.
Yes,
You're welcome.
to the program.
Thank you very
Thank
much.
you
Thanks
so much for
having
joining
me.
us.
Okay.
Thank
Yes,
you so much.
we all know that according to the World Malaria Report in 2022, malaria is one of the leading causes of death. Yes, before we go into how it is a problem, how it is a burden, now give us the overview of this seasonal malaria chemo prevention campaign.
Thank you very much. So the seasonal malaria prevention campaign is popularly called the FMC.
Okay.
It's a recommendation from the World Health Organization as one of the interventions to bring down malaria burden in Nigeria.
Okay.
So the pilot of this intervention was conducted in Katsina State, and results showed that 75% of malaria burden was brought down by this intervention. So it was upscaled
Okay.
to more states in Nigeria. So as
Okay.
of today, we have the SMC campaign ongoing in 21 states in Nigeria.
Wow, that's a very good one.
Okay. Now that there's this SMC, I think that's the abbreviation for it.
Yes, ma'am.
How far is the awareness?
The awareness is growing. Are we where we want to be with the awareness? No, but we are not where we used to be with the awareness on seasonal malaria chemo prevention. A whole lot of efforts have been channeled, sparring from advocacy visits
Okay.
to beneficiary states. We meet with their stakeholders, community leaders, religious leaders, heads of household to talk to them about seasonal malaria chemo prevention before the implementation proper.
Okay.
This is avenue to prepare their mind to talk to their followers, members of their communities, their children, caregivers, and all of that to present eligible children to receive this seasonal malaria chemo prevention when the campaign is ongoing proper.
Okay.
Yes.
No, it is now not out of place to ask what informed this seasonal chemo prevention campaign. It is not out of place to ask. So, what informed it?
Yes. You know, malaria, like you rightly introduced, is one of the leading cause of death globally.
Okay.
And in Nigeria, it remains a serious public health issue.
Yes.
Sadly, children under 5 and pregnant women are the most vulnerable to malaria. So, SMC was introduced to bring down the disease burden rate among children that are very vulnerable to this disease. So the SMC, the medication for SMC are in 2 categories.
Okay.
We have the SPAC 1, we have the SPAC 2.
You explain to us what is SPAC 2.
Is there elementary and secondary, just like that? Is that it?
So for the SPAC 1, I'll come back to explaining these big terms. So the SPAC 1 is for children from 3 months to less than 1 year.
Okay.
Then the SPAC 2 is for children from 1 year to 59 months. That's about 5 years.
Okay.
Yes. So this SPAC is an abbreviation for sulfadoxine, pyrimethamine, plus amidocrine.
Well done. Thank you.
I like that.
I like
Say
that.
well done.
SPAC.
Yes.
So the objective of this is to maintain a therapeutic anti-malaria medicine concentration in the blood of children that were rightly given the doses all through the rainy season.
Okay.
So they have this concentration of these anti-malaria medicines in their bodies, and this prevents them from having malaria.
Okay.
Yes, that is the strategy behind SMC. It is a preventive measure, not a treatment measure.
Treatment measure.
Yes.
Wow.
Okay.
Okay.
So let's talk about the rural areas.
Okay.
How far have you gone with that in creating the awareness?
Yes. Like I said before, We have SMC ongoing in 21 states,
Okay.
including the FCT. So there are 36 states in Nigeria plus the FCT 37. So most of the rural states have been covered with this intervention already.
So what strategies do you use to be able to get?
Beautiful. So when we start this distribution, this mass campaign, we have 5 circles or 4 circles, depending on the rainy season period in the particular state. In states where they have longer period for rainfall, we do 5 circles. Then in states where their rain period season is shorter, we do 4 circles. Because we are targeting the rainy season, the peak of rainy season in this state. That is when we have more mosquito bites because of water and all of that. So when we start this campaign, we make use of community drug distributors. These are women that live within existing communities, within a health facility. We involve the health facilities.
Or they are also health personnel.
They have been trained to do this.
Okay.
They've been trained to do this.
Okay.
So not just them, they are the ones that distribute these drugs. Then we make use of the town announcers. And
like town criers.
Town criers.
Okay. Do you go around visiting houses like?
It's been distributed household to household.
Okay, that's why they are using health personnel that are familiar with the.
That's how we use the community drug distribution workers. So the thing is, we have town announcers, we have lead mothers. What our lead mothers do is this: in the first day of the distribution, when we start, it takes 3 days to administer the old medication for that cycle.
Okay.
So we have 4 tablets. The first one, I don't have a sample. I would have shown you. So we have 2 tablets in the sachet that are taken on the first day as directly observed therapy. So that our lead mothers, supervisors are there to watch the caregiver administer this first dose to the eligible child.
Okay.
Then it is the work of the lead mother to visit all these households the following day to remind them to take the second tablet, which is the third.
Like a follow-up.
A follow-up. Then the third day, the last dose is being given for that cycle. So it's done 1 month interval for that period of 5 or 4 months, depending.
Okay, now you talked about malaria and you talked about typhoid. My question is, typhoid and malaria, must they come together? Are they brothers and sisters?
They are 2 different diseases. Malaria is malaria, typhoid is typhoid. But it is very possible for a patient to present with both malaria and typhoid. So that is why the need for a malaria test at the onset of fever is very important. So once a malaria test is being conducted and the patient is positive for malaria, the person should begin immediate treatment with ACT that I mentioned earlier on. So when you treat malaria, you treat typhoid. Malaria treatment is not typhoid treatment. So a patient that presents with both malaria and typhoid should be treated for both.
Okay, so let's look at the benefits of SMC.
Very important. The benefits.
What are the benefits?
There are a whole lot of benefits to SMC. There's a general saying that healthy babies makes healthy families. Healthy families makes for healthy society. Healthy society makes for healthy nation. So the benefits of SMC, basically, it prevents eligible children that were given the right doses at the peak of malaria season from having malaria.
So is it like an immune booster? Immune booster against against malaria?
Use the word we use for it. It is a seasonal malaria chemo-prevention medicine.
Seasonal malaria chemo-prevention
medicine.
So it prevents malaria.
It prevents malaria in eligible children that were rightly given these medications. Because why I'm emphasizing on this rightly is, if you give a child that is not up to 3 months, it is not efficacious. If you give a child that is above 5 years old, that child is out of the range of eligible children.
You see why we talk about age eligibility.
Then when you take the first dose without completing all the medications in that sachet for that month, for that cycle, it will not give you the results you want.
Okay, so let's look at this.
Yes.
Does it mean that adults are left out?
Adults are not left out.
Adults are not
This
left
is
out,
just
yes.
an intervention that is targeted for children.
Children.
Okay.
For adults, we have interventions like the SP that is being given to pregnant women. So I'm using this opportunity to appeal to pregnant women to register for antenatal care visits early and attend such visits regularly to receive the malaria preventive medicines that are given to pregnant women. These are called SP, simply put. So this prevents them and the unborn babies from having malaria. Malaria in pregnancy can be very consequential. It can lead to low birth weight. It can lead to abortion.
Yes, yes.
And nobody wants to have an high-risk pregnancy. So we should endeavor to encourage pregnant women around us to attend antenatal care visits regularly and insist on receiving this SP. Once that pregnancy is like 13 weeks, once they can feel the movement of baby, they should take this SP monthly, at monthly interval. From that time, they start feeling the movement of the baby till they put to bed. This will keep them and their unborn babies on malaria.
So as they are hearing us now, they should make sure they register early. Let them not go and take the SP as you have prescribed from here.
No.
Okay. I think
I
before
wanted to talk about the campaign.
Yes,
The
Okay.
campaign.
Yes.
How long will this campaign take? Or how long do you intend to carry out this campaign?
it will be a continuous thing for now, so long as we find donors, and because all these things are not free, they are being given to children for free, but at a point or the other, it was paid for. So long as there are donors, we are not just leaning on donors. We are looking at generating resources domestically from Nigeria. Let the government to take ownership for continuity, so that when the donors pack up, our interventions don't stop and we don't relapse.
For someone listening to you now, if the person wants to go ahead with this, to take this SMC, where will you direct the person to? Where are the points?
So long as you are a resident of the FCT, let me speak for Abuja, and even for other states where SMC campaigns are ongoing, our drugs will get to your household.
Okay.
Yes,
So
our drugs is a door-to-door, is an household-to-household intervention.
So
that's
not
the
that they
method.
can just go to the general hospital and see.
Yes. So for Abuja, we have the posts, the SMC and drug post is a new thing that was just introduced in this fifth circle. So if you go to general hospitals, health facilities in strategic places, you will see the post there where you see health care workers that are being seated to administer SMC to eligible children that comes to visit such health facilities. Yes, but majorly it is a door-to-door thing.
Okay. So before we let you go, you give us some, basic health tips.
Yes, beautiful. We are just saying malaria, SMC. What is malaria? So malaria, simply put, because of the type of audiences we have, it's a disease that is caused by the bite of an infected mosquito. Infected mosquito.
If the mosquito is not infected, there's no way it will bite you.
Beautiful. No mosquito comes with a signboard or a placard.
Yes.
I'm infected. Yes. So the best thing is to prevent yourself from being bitten by a mosquito. So we've spoken
by both infected
or uninfected, because you can't say by looking at any mosquito which one is infected or not. So please, there are many interventions that are ongoing to stop or to prevent malaria. SMC is one of them. Another one that I want to talk about is the use of insecticide-treated nets. I believe you all have mosquito nets.
We do.
So we advocate that these nets are not just on. People should try to sleep under the nets every night, all year round. Not just mothers, not just children, even fathers. Because if our fathers are bitten by mosquito and they fall ill to malaria, who goes out to cater for the family? It becomes a family thing. So we advocate the use of mosquito-treated nets by every member of the family every night, all year round. Also, I've spoken about the SP for pregnant women. They should attend antenatal care services regularly and receive these malaria preventive medicines. Then also the SMC is an ongoing thing. Caregivers should please present eligible children within the age of 3 months to 59 months to receive these malaria preventive medicines. Then, of course, the mother of all interventions will be the vaccine. So when the malaria vaccine is fully operationalized in Nigeria, this will be a big win for us in bringing down malaria burden.
Wow, that's a wonderful information.
Honestly, they say he that has ears, let him hear. Don't allow both the mosquito that is infected or the one that is don't even allow mosquito at all. Thank you so much.
Thank you so much for coming.
Very, very informative. Yes, we've been able to understand a lot about SMC. Well, you've heard it. Please, you can go to, like she said, door to door. They will come to you, or any of the hospitals. But please make sure you protect yourself. So thank you so much.
Thank you very much. Thank you for having
your time.
Thank you so much.
So the program continues after this.